Hi, my name is Dr. Steve Petzel. I'm the owner of a DC Health Center, and today I want to talk to you guys about neck posture and headaches. So what we're going to do is go through a couple studies, and then we're going to follow up with the correction and what could be done to correct this problem. So let's first look at a normal cervical curve here. So we've got the normal one on the left, the abnormal, the reverse curve on the right. And as we can see, there's a nice C shape that's going in the spine on the left, and we've got a reversal of that C shape in the one on the right. The one on the right is going to have those bone spurs in the front, which can be seen right along the front of that margin there. So let's start with the first study. So when we looked at a study that composed of 6,000 cases of chronic headache sufferers, they found that a complete or reversal of that normal cervical curve is the most characteristic feature and is often the only abnormality found. Now this study was done by Broff and Rosner, and this really showed a lot where you're looking at a large amount of people and you're able to see that the curve in the spine does a lot in terms of, getting rid of people's headaches. So if you do have a reversal of that curve, if you do have a straightened curve, then you definitely want to get checked out and get an x-ray and make sure that we can start correction as soon as possible. Let's look at this next study here. We've got Vernon's study where he had 47 subjects and they had tension and migraine headaches. What they found is hyperlordosis, which is a decreased curve, as well as straighten and reverse cervical curves, led to these subjects having headaches. Now, below that, you can see a picture that was used by chiropractic biophysics, which is a correction technique to really get that curve back into the neck, as well as the natural curves in everywhere in the body. But what we're looking at here is, as we start on the far left, we've got a normal curve. Now, as we start going to the right, we can see that red line, which is going to be placed at the posterior body of that vertebral segment. We can see that the curve is slowly going towards that reversal. So we start at the left with a nice C curve there, then we start going further and further forward, and the green line that's superimposed on that image is normal. So we can obviously see it directly also leads to degeneration and spinal arthritis. The third study here, we compared 372 patients with tension headaches, and we compared them to 225 subjects that didn't have any headaches. Now what we found in this one was that they did find low shoulders as well as straightened curve of the cervical spine to be one of the only elements that they were able to find. Now let's look at how to correct this. So now using what we've learned from chiropractic biophysics, which is the technique to correct the spine, we can see this device that we use in the office, which is called a Denneroll. Now the Denneroll is placed at the position that needs the curve the most and where we need to implement the correction, and once you lay on it, we increase the time until we max out around 20 minutes. Now this is a safe, gentle, easy way to get that correction into that spine, get rid of some of those headaches, get rid of some of that tension that you might be feeling. Now we got a before and after as well. This is just after one session that chiropractic biophysics provided, and this is a study that shows you there's definitely correction now. Yes, is that going to stay like that for several weeks? No, because that was just one session, but you can obviously see the power of just one session going onto the Denneroll and the ability to start changing that spine and creating a nice curve in there to help with those headaches, get rid of migraines, get rid of that tension type headache as well. If you want to come in for an appointment, give us a call, 630-887-1900, and we'll do a free examination and consult on you and see if your case can be taken care of, and if so, what we can do for you.